So just for the benefit of those participating, the first time the term telemedicine presented itself in the medical literature was 1974. And it was done by a physician out of Harvard School of Medicine. And they were looking at trying to keep nursing home patients in the nursing home, not sent into the emergency room if they didn't need to go. And if you read that article today and washed out any of the dates or times, it would be just as impactful, just as relevant today as it was back then, the purpose, the need, what they were doing. And so you kind of fast forward to pre-COVID, let's say December of 2019, most people have heard the term telemedicine. They probably haven't experienced it. The total number of telemedicine visits in 2019 was less than 1/1000% of all the visits done in the United States. And you just fast forward 9 months later, and telemedicine has blown up. We are doing Medicare telemedicine visits 2019, 14,000 per week. To date, we're doing 1.1 million visits per week. It's just astronomical. We really don't even know where we're going to land this year in the total number of telemedicine visits. And so it's a technology that's been around a long time. And you look at how technology's evolved, right? So in 1974, no home PCs, no laptop computers, no iPhones, no iPads. And yet we have all this technology today, and we really weren't using it until COVID. And COVID was really the primer that got people to say, hey, look, there's another way that we can receive access to healthcare. And so, let's explore using that as a way of keeping people safe and reducing utilizations of, personal protective equipment. For us personally, and for me personally, I started my journey into telemedicine accidentally. I finished my residency in 2006 and joined the 82nd Airborne Division, motivated by the circumstances of September 11th. And I was deployed to Afghanistan as a young physician, recently out of residency, taking care of very sick patients, providing care to people with tuberculosis and leishmaniasis and other diseases I only learned about in textbooks. And so having access to experienced physicians around the world through the Army's infrastructure really changed my ability to keep people local. Ultimately, I can't just pick up a phone and call and say, hey, I've got this really sick patient, let's move them. There's a lot of operational considerations and environmental considerations and other things before we can move somebody. So if I didn't do something quickly, these people could get sick or die. And so telemedicine was a really important part of keeping people safe. And interestingly, my first job in rural North Carolina, just coming out of the military, I saw the same challenges, but no telemedicine infrastructure. And so that was really the focal point that said, hey, look, we need to figure out how to bring telemedicine to these communities and do it in a way that we've just never done before.